Hi, my name is Carrie Weaver. For my statistics project, I looked at cancer mortality and socioeconomics in Lancaster County, Pennsylvania. I live here, I'm a nurse here. I've been really interested in public health and looking at data trends for certain illnesses and disease trends. I've been really interested in looking at disparities between care. And I've been really interested in looking at cancer specifically. So I got all my data from 2010 to 2015. So what was going on in Lancaster County then was an estimated 500,000 people lived here. The county was growing by 2.83%. 87% of Lancaster was white. Approximately 34,000 were Amish. And as of January 2015, 7.96% of the county residents lived below the federal poverty level. Here's a little table from Lancaster County Health Needs Assessment. It looks at how poverty in Lancaster compares to Pennsylvania. So the first article that I looked at for my research came out of Washington State. They sent out questionnaires and they followed people through their socioeconomic status. They looked to see if they died from cancer, if they got cancer, and they asked all kinds of questions about their lifestyles. So they found that health behaviors like smoking, physical inactivity, and diet accounted for a large association between area-level socioeconomics and cancer mortality. They also found that health behaviors account for some, but not all, of the association between socioeconomics and cancer mortality. The second article was a literature review, kind of like a meta-analysis. The authors looked at all of this information and then kind of combined it all. They found that despite better access to health care, there remains disparities between race and those living in poverty. Causes include the environment, behaviors, social cultural factors, and biological factors. Poverty sets the stage for low education, unhealthy behaviors like smoking, and poor environment. They're more likely to develop chronic diseases and cancer. Obesity, diet, and nutrition may be important factors for cancer risk, and poverty, race, and ethnicity may influence cancer treatment and survival rates. The third article was a study that took place over 6 decades. They looked at cancer mortality, incidence, and survival, and socioeconomics and racial disparities. They found that blacks have a higher all-cancer mortality rate than whites. This is likely due to health risk behaviors, healthcare access and use, and cancer treatment and survival. Individuals with lower education and income groups had higher mortality and incidence rates, and disparities in incidence and mortality from various cancers reflect difference in smoking prevalence, dietary patterns, obesity, physical activity, things like that. So I had so many questions. I was wondering, in Lancaster County, are people in higher areas of poverty, like here in the city, more likely to have cancer? Are they more likely to die? Are there any areas that had higher than average levels of cancer? Was there any certain race affected by cancer more than another? So I kind of had to narrow it down to a broad question, and I decided on, does socioeconomic status correlate with cancer mortality in Lancaster County? My research hypothesis was that it does, and the null hypothesis was there's no relationship between cancer mortality and socioeconomics in Lancaster County. I used several websites to find all of this data. Lancaster General Health puts out a community needs assessment, so I was able to look at the 2016 one, and it went over all kinds of disparities in Lancaster County in treatment. I also looked at the Census Bureau. That's where I found all the populations for individual towns here in Lancaster. I found my statistics on cancer through health.pa.gov, and I was able to actually create a map of Lancaster County and the poverty ranges from the Environmental Protection Agency. So this is all of my data. I looked at 60 total little towns or townships in Lancaster County. I recorded all of their populations from the census. I recorded all the total cancer cases, males and females, from 2011 to 2015. The total cancer deaths, males and females. I looked at total female cancer deaths, white female cancer deaths. I looked even at breast cancer. I thought for a little bit maybe I would want to narrow down my project to that. And then I made a whole bunch of percentage columns so I could analyze the data. So I looked at things from percentage of death out of cancer cases to percentage of the population with cancer. So I looked at all this data and I plotted it on a map, and it was kind of confusing. It was too much data, so I decided to narrow it down. So I took the top 15 most populated areas in Lancaster County. I thought that if I took the most populated areas, there would be more of a chance of accuracy. And I looked at total cancer cases, total cancer deaths, and I found the percentages for each of these 15 places. And the higher than average ones I highlighted here. So like West Lampeter Township, Salisbury Township, Lancaster Township, Elizabethtown Borough, and Columbia Borough. So these had higher than average percentages of death from cancer out of all of these cancer cases. And then I plotted it on the map. So from my data, I found that total cancer cases between 2011 and 2015 in Lancaster County was 14,000. Out of those cases, the total deaths was 5,000, and that it counts for about 40% of the cases who died. The percentage of the population with cancer was 2.7%, and the 15 most populated areas of Lancaster that I looked up makes up 55% of the entire Lancaster County population. So, this is the map that I made. This is the map of the highest cancer death percentages in Lancaster County's most populated towns. The key over here shows that the population below poverty level ranges from yellow to red, yellow being least poverty, red being most poverty. So you can see here Elizabethtown Borough has mostly orange, Columbia Borough has mostly orange, Lancaster Township has yellow and red. So I was hoping that I would see clear areas of red with areas of cancer deaths, but I really wasn't able to correlate or find any conclusive evidence that higher cancer mortality rates occurred in the area of lower socioeconomics. I could broaden this research to looking at overall cancer rates instead of just cancer mortality. If I had all the time in the world, I would break down each area by air quality and smoking and exercise, look at the parks, look at waterways, all of that stuff, and maybe I could find a correlation. And also, if I had area level poverty data, I could run t-tests and look at the p-value and all of that. But the poverty data there wasn't a lot of access to that. Thank you.